So let's do a little sample problem. Let's say your pH is 7.31, your CO2 is 52, and your HCO3 is 24. In this particular case, I know a lot of teachers use different mechanisms. They use the tic-tac-toe, they use the Rome. Those are fine. If they work for you, keep using them, please, by all means. But I like to understand the why and the how. So when your pH is 7.31, we have to agree that it's below the reference range that we have. And the lower your pH is, the more acidic it becomes. So we know for a fact that 7.31 represents acidosis. Now, we have to find which of these two, the CO2 or the HCO3, is responsible for this low pH value. Well, we should understand basically that CO2 represents acid, right? Lungs, CO2. And your HCO3 represents metabolism or your kidneys, because your kidneys are the ones that can either excrete or retain the hydrogen ions or the HCO3. So in this case, we've established that the pH is below 7.35, so we know that that's acidosis. And which of these two matches that rationale? Well, you're supposed to have too much acid, and the CO2 is above its reference range of 45, so we have a high concentration of acid. And our HCO3 is normal, so that's how we know that this condition is respiratory acidosis. But what if we have another scenario? Let's say that the same stuff is happening. Your pH is 7.31, your CO2 is 52, but now you have an HCO3 of 30. What's going on? Well, it's the same thing, except now the body's trying to fix the issue. So this is still respiratory acidosis, but now the body, the kidneys are trying to say something. They're trying to say, hey, you know what? The lungs are keeping a lot of that acid, a lot of that CO2. Well, I can do the same thing. And so it's trying to reuptake its ion concentration to increase the HCO3 so it can kind of be at par with the excessive CO2 levels. So this is partially compensated respiratory acidosis, partially because the pH is still out of whack. It's still not normal yet. So we're not fully compensated. It's partially compensated respiratory acidosis. Okay, let's do another one real quick. Let's say that your pH is 7.29. Your CO2 is 41, but your HCO3 is 19. What's going on here? Well, same way of analyzing this. The pH is 7.29. We know that's below, so we know it's acidosis. Your CO2 is normal, which is weird, right? Because normally your CO2 represents acid. When there's an abundance of it, it's going to pull the pH down to make it more acidic. But that's not why it's happening. Your CO2 is at its therapeutic value. So we look at our HCO3. Our HCO3, our bicarb, should be between 22 and 26. But right now, we don't even have enough of it. So because we don't have enough of what's supposed to be in its reference value of base, we don't have enough alkaline. So now the normal amount of CO2 is still in higher concentration when it comes to ratio. There's more CO2 than HCO3 because we don't even have the bare minimum of HCO3. So in that case, we still have acidosis, but it's being caused by a metabolic issue, and that's considered metabolic alkalosis. So I hope this kind of makes sense, folks. Please follow me on Learn NCLEX Now, and I'll see you guys soon.